Fertility for men with cancer. Sometimes men find out they have cancer while they still hope to have children in the future. If this happens to you, it is important to know how your cancer or cancer treatment might affect your fertility or ability to father children. Based on your wishes and health, there may be options available to increase your chance of having children after your cancer treatment has ended. Not all cancer treatments affect fertility. Ask your doctor if the treatments planned for your care can change your ability to father children. Your doctor can explain these changes and if they are temporary, long-lasting, or permanent. Before your cancer treatment begins, it is important to talk to your doctor or another member of your healthcare team about your desire to have children. A cancer diagnosis can cause emotions and feelings that you may never have had before. Thoughts of your sexuality or fertility may not seem important at this time. However, by talking about this topic before starting cancer treatment, your doctor can offer more options to protect your fertility than if you share this information after treatment starts. If you have fertility problems, it is common to have many different feelings, such as sadness or anger. Reach out and share your feelings with those you trust. Spiritual or professional counseling may help you understand the reasons for your feelings and how to manage them. Talk to your healthcare team about any physical or emotional changes you may have, so they can offer support, and if needed, refer you to a specialist for problems such as anxiety, depression, sexual dysfunction, or other sexual concerns. Physical changes from cancer or cancer treatment that can cause fertility problems in men include damage to the sperm, not being able to make enough sperm, or not being able to make enough semen, which is the fluid that carries the sperm during sex. Problems can also happen when there is damage to the pathway in the man's body that the sperm must travel. Cancer treatments that can cause fertility problems include surgery to the testicles, prostate, bladder, colon, spine, or other parts of the body that may lower a man's ability to make sperm, semen, or have an erection. Use of certain chemotherapy or immunotherapy drugs. Some types of hormone therapy can cause fertility changes, as can a bone marrow or stem cell transplant. Radiation therapy to the testicles, pelvis, prostate, brain, or whole body radiation may also result in fertility problems. In addition to certain types of cancer, such as testicular, prostate, bladder, or colon cancer, and some cancer treatments that can cause fertility problems, there are other factors that may lower a male cancer survivor's fertility. Some of these factors include age. Fertility may decrease as you grow older. Health problems, other than cancer, can affect your fertility. Previous problems, either getting or keeping an erection, may also need to be treated. If your cancer or cancer treatment puts your fertility at risk, your doctor may suggest you meet with a healthcare provider who specializes in this area. This may include a reproductive urologist. This medical specialist works with you to provide treatments which can improve your ability to father a baby in the future. They may suggest you take action before your cancer treatment begins, or recommend safety measures during treatment. Reproductive urologists can also talk with you about available fertility options after the end of your cancer treatment. It is important to know the risks involved and the chance of success for each fertility option your doctor may suggest. In some cases, more than one fertility option may be available. Men should include their wife or partner in fertility discussions and the decision-making process as much as possible. Fertility issues can affect your wife or partner and your relationship. Your doctor can explain the options to help protect or keep your fertility. These options will be based on your cancer, its location, your cancer treatments, those planned or already received, and any other health problems you may have. Share with your doctor any cultural, religious, or personal beliefs you have about medically assisted fertilization, so the right fertility option can be chosen. If your cancer treatment has not started, it is important to know that some options to protect male fertility take time to complete. Your doctor can review which options are best for you based on when your cancer treatment is to start. Your doctor will also explain if any of these options would delay the start of your cancer treatment and how that delay might impact your cancer care. Here are some of the fertility options used to help protect or keep fertility. If chemotherapy is planned, your doctor may be able to choose a type or dose of chemotherapy that has a limited effect on your fertility. If radiation is planned, shielding or protecting your testicles may be needed. This option is based on the type and location of radiation to be given. Sperm banking may be suggested. This is the freezing and storing of sperm for future use. This process is encouraged before cancer treatment due to possible damage to or a decreased ability to make sperm after treatment. Electroejaculation is used when you are unable to provide a semen sample on your own due to health, cultural, or religious reasons. This procedure involves the use of special medical equipment to collect semen. This procedure is typically done under general anesthesia. Testicular sperm extraction can be used in cases where sperm remains in the testicles. With testicular sperm extraction, surgery is used to remove the sperm from the testicles. The sperm can then either be frozen for use later or used right away to fertilize a woman's egg. Artificial insemination is another option that involves a medical procedure in which a man's sperm is placed into a woman's womb or uterus through a narrow tube, sometimes called a catheter. If your fertility problems make you unable to get or keep an erection, your doctor can share different treatment options that may be available. The science of fertility for cancer survivors continues to grow. New promising research and treatments are being studied so larger groups of cancer patients can have the ability to bear children following cancer treatment. There are times during or after cancer treatment when you might need to take precautions and use birth control to prevent pregnancy. For example, it is very important to not have unprotected sex while you are being treated with chemotherapy. Chemotherapy could damage your sperm's genetic makeup and cause birth defects. Your doctor will let you know when and how long you need to use birth control. Insurance companies may or may not cover the cost of fertility testing, treatments, and other related charges. It is important to check with your insurance company about what fertility treatments are covered. You may also want to check with your employer or insurance company to see if there are other health plans available to you that include fertility coverage. Ask your doctor about any organizations or resources that may be available to help you with the cost of these treatments. Based on this coverage and your finances, decisions for treatment can be made with your healthcare team. If fertility treatments do not work or are not possible, adoption of a child through various agencies or private adoption may be an option for you. You may want to talk to a lawyer about adoption options. They can help explain any legal issues that you should be aware of with these choices. Some people, along with their partners, decide to not have children after a cancer diagnosis. Due to fertility problems, or based on their goals for the future, they choose to focus on other areas of their life other than having a baby. These are very personal decisions that should be talked about openly and honestly by couples in order to reach a decision that is comfortable for both. We hope this information has helped you to better understand the impact cancer and cancer treatment can have on your fertility. Options to protect your ability to father a child in the future should be discussed with your doctor as soon as possible after a cancer diagnosis. Write down any questions you might have for your healthcare team and bring them with you to each appointment. We are honored to care for you during your cancer treatment. Thank you for choosing the James.